Broadcasting from the business capital of the world, this is the Podcast Business News Network.
I know a lot of us are challenged from some things medically, physically, you got things going on. Wouldn't it be great if you could take something natural, not a med that you got a script for, but something natural, not putting chemicals in your body? Well, you can. They've been doing that for hundreds, if not thousands of years. We're going to talk about herbal remedies today with somebody who is a medical intuitive, but also has a medical background. And she's helping people all the time. She's amazing. Dr. Gloria Warren is back with us. How you doing?
I'm doing well, thank you. How are you?
Fantastic. And I'm glad we're talking about this today. It was last fall. I was having digestion issues, stomach issues. I'll be honest, I was about ready to go to the hospital. I was like, I don't know, something's not right here. I got diagnosed with an ulcer maybe 7 years, 6 years before. And I met a master herbalist, gave me a concoction. 2 days, I was fine. Amazing.
I believe it. Yeah,
And,
it's amazing sometimes what they can do.
and I got scoped all over, and it turned out that I had um, gastritis and moderate or slight diverticulitis. No issues now. Everything's fine. But the turning point for me was the herbal remedy. And I think a lot of people don't realize it. They just think, oh, it's that woo-woo stuff. I'm going to eat plants. Well, isn't that where traditional medicine came from in the first place?
Absolutely. That's where pharmaceuticals get their uh, interesting start with all of their medications, is in herbal remedies, whether it be Native American or Chinese or rainforest medicine. And I mean, there's been some big pushes, especially with rainforest medicine in the last couple decades. So yes, definitely.
So today we're going to get from you a challenge that somebody might have and what they could be taking herbally, right?
Absolutely. I'm going to go through several different basic problems that most of the population has from time to time. So it'll give everyone a good base of potential things they could take. Of course, you should go through things with your physician as well, but at the same time, these are things you can get started on today, right away. So, first thing I'm going to go through is GERD, gastrointestinal problems, especially, upset stomach and things like that, and too much acid. Of course, there's things in Western medicine like Prilosec, Prevacid, and a couple of others. They do work, but according to the California Conference of 2007, those should only be used if blood is involved because they have long-term effects, negative effects on your heart muscle. So, it is one thing to take something like that for a few weeks. Let's say you have a bleeding ulcer. Wonderful, take it, but follow your doctor's recommendation on that. It isn't good to stay long-term on those type of medications. So things regarding upset stomach or too much acid or not enough acid, you may question, well, what do I take specifically for too much acid or possibly not enough acid? So when you eat a big meal, if you get a sour stomach, that means you don't have enough acid. So apple cider vinegar is wonderful for something like that. However, if you're between meals and you keep regurgitating acid, then maybe you need to think of other things like black seed oil is wonderful. If you do have an ulcer, it actually kills the bacteria of the ulcer in your whole gastrointestinal tract. But you can also take simple things like ginger, aloe vera, fennel, parsley, marshmallow, turmeric, milk thistle, slippery elm. I mean, there's a whole list of things you can Google on and look at and try to take. You look at how much they recommend. Try half first to make sure you don't have a reaction, and then you can always add to it. Some of those things, especially ginger. I'm a big believer in ginger and licorice for that. So, go ahead and try
Can
that.
I share? Can I share?
Sure.
All right. Ever since I had those stomach issues, every morning I have ginger tea. The concoction that the master herbalist made up was marshmallow root, cat's claw and catnip in a little dropper bottle. And the other thing that was suggested, which I did, was aloe vera, like you said, but most importantly, aloe vera with pulp, which is supposed to coat your stomach if you have some issues, maybe a bleeding ulcer, whatever it might be. And that was the game changer. That's what did the job. And I'm talking like 2 days, I felt great. 4 days, it didn't even exist. It was like never even happened just from taking that. And I've shared all of this with friends because I didn't finish the bottle. So I was like, here, you got a problem? Try this. So
Try
everything you
it.
just said, everything you just, I'm a dealer.
Right.
Everything you said is exactly on point with what worked for me. So yeah. Wow.
Yep. I mean, there's so many different things that there is out there, naturally speaking.
Sure.
And sometimes it's worth going ahead and trying natural remedies first before you try other medications. But it all depends too. Like when a patient comes to me, I look and I evaluate what level of problems are they having. I mean, do they have a bleeding ulcer? Are they getting black stools? Are they, throwing up blood? That's a different story. They're throwing up blood, send them in the emergency room
Right.
and get something right away and get looked at. But there
I
are
want to
things at
add, I
home.
want to add something with, black stools. Pepto-Bismol. You take Pepto-Bismol, a lot of, have some more, have some more. It will do that. So it can kind of freak you
Right.
out. And when you think I have a serious problem, it came from that. Just sharing.
That's true. Pepto-Bismol as well as Tums and Rolaids, they contain calcium carbonate, which actually can block up your arteries. So I'm a
Wow.
huge believer, no calcium carbonate in any of my vitamins or anything like that. I'll do calcium citrate and things of that nature, but never calcium carbonate. And oyster shell calcium is calcium carbonate as well. So just heed that suggestion, and you may want to check. So we have some hypertension remedies, which would be things like hibiscus, lavender, ginger again, cinnamon. Cinnamon's great for high blood pressure. Pomegranate, beets. Be careful with beets, though. Too many beets can cause kidney stones, gallbladder stones. Same with dark chocolate. Vitamin D. There's another whole list of things. Garlic is always an excellent one, and apple cider vinegar for high blood pressure. What I actually do is I grow my own yucca, and I take yucca root. I harvest it once a year, and I chop it up a little bit, dehydrate it, and then I grind it up and yucca tea 3 times a day. It takes down high blood pressure. So I think I mentioned this in one of my other shows. I'm not a prepper, I'm a survivalist. And certain things can help bridge the gap when you don't have the correct medications around. So some of these herbal remedies are very helpful with that. So then we have a high cholesterol. This is one I definitely want to mention to you. Cinnamon, there again. Red yeast rice, fenugreek, licorice, hawthorn. But you have to remember, though, if you have high cholesterol and high blood pressure, you may want to not take licorice root. The reason is licorice root will raise your blood pressure. That's fine if you have blood pressure, hypotension. So there are specific ones for that high cholesterol. One of the best things is if your arteries have some types of occlusion, but it's, let's say it's not calcium carbonate blocking it up, but fat. Maybe your cholesterol is too high. So you need something to take it down quickly. Niacin is a common practice even amongst physicians. However, you need to really heed the dosage. Some of these niacin tablets are 100 milligrams. Or 50 milligrams. But if I took a 50 milligram niacin tablet, I would actually get my cheeks would turn red. I wouldn't feel good. I'd have to sit down right away. I'd get a really bad niacin rush. And so you need to start low dose, maybe 25 milligrams, but it actually is the number one thing to lower cholesterol. So keep it in mind, but just be careful when you first take it. You can build up to it. Body weight means everything when it comes to any type of medication or herbals of sorts.
What if you are taking a cholesterol lowering med like Crestor and You also want to be proactive. You want to get off of the med. Can you also take some of the things you recommended?
You can at low dose. If you're taking a low dose of Crestor or whatever, take a low dose of the herbal, and then you need to get another blood test after 2 months and have it checked again, see how low it went. And if it went down to the lower part of norm, you may want to ask your physician to take you off of Crestor and go on herbal, or you may want to keep up the same balance you're doing. Or if it didn't drop, you may want to increase the herbal remedy.
Hmm.
So, but it's okay to tell your doctor, hey, I'm taking niacin every day to lower my cholesterol. Could I possibly come off of my Crestor for a certain period for 3 months? And let's see what that does. And most physicians will probably entertain that idea because it is a common practice, the niacin therapy for cholesterol in the medical industry here in Western
Hmm.
the US.
What are your personal thoughts while we're on cholesterol? What are your personal thoughts on those types of meds?
It caused liver damage over time. And I do know that your liver is what controls a lot of your cholesterol levels in your bloodstream. So my first response to high cholesterol is cholesterol really does not tie in directly to heart disease. And my first response is, well, if you want to lower your cholesterol, that's fine. It'll lower your chance of getting a stroke or something of that nature. I would say herbal to start and see what happens. But culture means everything when it comes to cholesterol levels. So if you're from Russia, let's say, you can run 300 on your cholesterol and never have heart disease. I knew a woman who was 99 years old. She was always over 300, never had anything wrong with her heart or arteries or any blood vessels. I mean, she was perfectly fine.
Hmm.
She died of something totally different. But
Hmm.
it all depends on culture. A Mideastern higher cholesterol is more detrimental to show up in heart disease some way, shape, or form. So if you're Mideastern of Jewish descent, culture means just everything when it comes to cholesterol and heart disease. Culture means a lot when it comes to any medication. And this is one area of expertise I have that many physicians just don't really pay attention. So if you take medications and let's say you're Asian descent, your body is actually going to excrete that drug much slowly. It's more slower than somebody, say, African descent. And then in Africa, they excrete the drug much faster than normal. So these are things that need to be taken into consideration if you're of a different culture other than just European. You need to bring that to your physician's attention. And as far as research, there is research out there regarding culture and excretion rates. So you
Hmm.
don't want to have too much of anything in your blood and any buildup either. So it's something to consider. So I do want to hit on diabetes, though.
Sure.
So many people are getting to be diabetic in our country today. All the simple sugars, the grains we eat are not healthy for the most part. So also high fiber, everyone's like, oh, high fiber, but actually that causes a lot of diverticulitis and gastrointestinal problems over time. So you do want to stick with mostly fresh fruits, vegetables, olives, things of that nature. But for diabetes, you can actually hinder your uptake of blood sugar naturally with fenugreek. So I used to
Hmm.
take fenugreek tablets if I'm going to have a stack of pancakes, because then my blood sugar wouldn't go up.
Wow.
I used to be severely diabetic. I'm not diabetic anymore because I've balanced my diet out correctly and it's working well. But there's other things that help with diabetes, and another, here again, aloe vera. One important point about aloe vera, though, is please do not harvest it yourselves. You really should go through a company that harvests it, and they have organic and a lot of different um, type of regulatory things in place, because aloe vera can be toxic. You can't just cut off a leaf and think you're going to squeeze the juice and use that. It is toxic. It has toxicities in it. So if you are harvesting yourself, the only part that's actually non-toxic is if you You slice it lengthwise, you take out the pulp, throw it away. And you just scrape the juice from the outside of the leaf. I just think that your risk factor is much higher then, and you're better off just to buy a pre-made product. Just make sure it's made from an organic farm, and there's no extra sprays or anything placed on those, and it's harvested and processed correctly. Okay, with
How
good.
much should you take? And I actually, when I was doing the aloe vera juice, one was maybe it had an artificial sweetener in it. Wasn't a fan of that. However, it had a lot of pulp, so I needed that at that time. Then I got a bottle of, I think it's concentrated. It's not a huge bottle, but it's organic and it does have pulp in it. But I never know how much to take. And is it okay just to take it on a regular basis?
You should never take anything on a regular basis for more than 3 months. That's my thoughts.
Okay.
Because no matter what you take, there's always a negative effect. Say echinacea. I had a patient once, she insisted she had been taking echinacea for over a year and she's going to stay on it. And I tried explaining to her, but echinacea will cause liver disease if you're on it too long. So it's just, you don't want to eat mustard every day, in other words,
Okay.
or you don't want to eat any one thing every day.
Is this the exception, taking fish oil?
Fish oil, it has been known to have heavy metals, so just make sure that there's no heavy metals in your fish oil. I'm a big, strong believer in cod liver oil. I worked for an oncologist for several years, and I remember asking him, if you had to choose one thing to get rid of cancer the most, what would you pick? And he sat there and thought for like 20 seconds. And then he turned and looked at me. He goes, cod liver oil. The only thing is you need to make sure that there aren't any heavy metals in it. So
Hmm.
sometimes the processing of some of our foods can be good for us.
It's just not easy. Like here I am like, fish oil, this is great. I take fish oil. I, back in the day, used to take it.
Yeah.
Then I pressed the pause button because I believe I took too much and I got a nosebleed and I was like, I don't want to deal with that. And then
Yes.
I went back to it, and I think I take 1,200 a day. Um, but now I'm going to go home and check about the heavy metals. Although I got on it initially because somebody told me, if you're going to do it, and you should, go for the premium brand. So I take Nordic Naturals. I think it's, a solid
Oh,
brand.
yeah. I like that
Um,
brand.
yeah. So, I mean, you pay a little bit more for it, but hey, it's worth it. Um, so I got to believe maybe there's no heavy metals in that, but I think, be honest with you, even skin wise, it's better if you take fish oil for a period of time. Um,
Right.
yeah. So
Can be a blood thinner though. So just be careful with that.
right. Well, why would that be such a bad thing? I mean, aside from the nosebleed, if
Well,
you
if your
overdo it.
platelets get too low, you can have a stroke, a breakage. There's two kinds of strokes. There's the blood clot ones, and there's also the vessel breakage ones. And it can lead to vessel breakage. It can thin down your vessel walls over time. So if you're going to take something like that, I wouldn't take every day, maybe 3-4 times a week. And that's something your physician would need to know, though, just so that he knows that your platelet count's probably a little lower than what it normally would be for you. So, yes.
Hmm. Wow. Lots to learn here. Um,
You can get too much of a good thing. That's all it means. So, what I do is I minimize everything as needed and maybe a little extra here and there. Like I was really sick this past month. I got West Nile virus, and
oh
oh
my
my
gosh.
gosh, that take me out. But I definitely took my herbals that I knew would get me out of it quickly. And I did high doses zinc therapy quickly. But you can't stay on zinc too long either because it changes the shape of your red blood cells. And in the differential that you get done, you get a complete blood count and a differential, which is the microscopic part. It'll show up that your red blood cells are not normal as far as their shape. So,
Wow.
you as soon as you can get off of it, better yet, and just use it when you need it. Minimize and a little bit for upkeep of health
Wow.
should be fine.
All the more reason to consult somebody like yourself because now it's like now I'm, you know, I now I'm concerned, like not to take anything unless it's vetted out by a professional. Couple of minutes left. Can you tell us any other things that we can take?
For diabetes, neem. A lot of times, diabetes is caused from types of grubs in your gallbladder or your pancreas, and it can cause havoc in your system. Um, think of like a leech. I mean, that's like the biggest thing that you can think of. A medical community doesn't usually do much for that. And neem actually it's like a in-body pesticide. So it cleanses out your digestive tract, including your gallbladder and pancreas. So, if your problem of diabetes is caused from some type of parasitic infection, this would help. And that's neem, the leaves of the neem plant. You can get neem powders, you can get capsules, you can get some oils if you want, and basil. Basil's another one good for that. So
Hmm.
it depends too on what is causing your diabetes, in other words.
What about, you mentioned the P word, so got to go there. Parasites. If you suspect that you might have them, um,
Yes.
and there's many different ways to tell different tests. You can take a urine test if it's the right type of test and make it tell. Um, what can you take? Is there any one blanket
Well,
herb?
unfortunately, what I believe is ivermectin is a broad span, broad scope anti-parasitic in your whole body. However, ivermectin is very hard to come by, even though I believe it is not damaging to your body pretty much at the right dosage, which I would do 4 milligrams for every 50 pounds. So me, I'm like 140, 145. So I would do probably a 12 milligram. So, but outside of what I believe, the medical community does not want us to use ivermectin, but there's other things we can use. We can use walnut extract. Black walnut extract is wonderful. Black seed oil helps with that as well. Um, they have parasitic cleanses, but I believe a parasitic cleanse is very hard on your liver and gallbladder to do. I think it
Hmm.
can cause some damage because it's so much oil at one time for your body to, process. So
Hmm.
I would do black seed oil and black walnut oil. And I
So-
actually make my own black walnut
oh
um,
wow.
tinctures. Hmm.
Somebody told me coffee enema can be helpful to clean things up with a parasite.
Well, that's only in your colon. The problem is parasites don't just stay in your colon. They're in your small intestines, they're in your large intestines. If you get it, they're going to be throughout your whole gastrointestinal tract. So even tapeworms come up into your mouth sometimes if you have a tapeworm. So it could go one way or the other. And it's not enough. That's all I'm saying. It's not enough. The other thing is when you do any type of enema, it's going to disrupt your natural balance of your healthy bacterias. So anything you do for parasites, you need to follow up about 48 hours later with high doses of probiotics and prebiotics. It's just very important to get that natural balance back quickly so you don't end up getting some kind of bad infection like C. diff, which could kill you. So you need to really watch how you balance it all.
Wow. That leads me to you. How do we find you? How do we connect with you? Ask questions? How do we do that?
Well, I do have a website, medicalintuitivegloria.com, and my phone number is 715-892-6304. Text is best. If you need to get a hold of me and you need to get a hold of me fast, please text me because there's so many spam calls coming through. I don't answer a lot of it. But when I see a text, I need your help, please call me. I'll call
Hmm.
you back. Okay?
And a final question here. We didn't touch upon this time the medical intuitive portion of you, but could somebody even go before you for an evaluation? And could you tell them? I think you have parasites in your
Yes, I would
digestion.
see that.
You would. You would.
Mhm.
Wow. Okay. Fair enough.
Definitely would. I would see any one of the topics that we covered here today.
Thank you.
Yeah.
Always appreciate talking with you and always learn a lot. Thank you so much.
Likewise.
All right. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.